To learn more about digoxin heart, please listen to this read by Dr. Trantat. Cardiac pacemakers are simply understood as drugs that increase the muscle contraction of the heart muscle, used in cases of heart failure. These drugs are divided into two main groups, non-glucosidic and glucosidic cardiac support, in which digoxin is a typical cardiac aid usually used by physicians in clinical practice. Effects of digoxin. Digoxin increases cardiac indirect contraction through sodium, potassium, adenosine triphosphatase, sodium plus potassium, ATP, inhibitors of the ionic pump in the myocardial membrane. Because of this inhibition, the sodium concentration in the cell increases, so the transport of sodium plus calcium 2 plus through the cell membrane is also inhibited. Increase the concentration of calcium 2 plus in the heart muscle cells, thereby promoting the cardiac muscle strengthening contractions. On the other hand, digoxin also affects the autonomic nervous system of the heart, decreases the heart rate and slows the conduction of the atrioventricular conduction. In addition, digoxin also increases the sympathetic tone of the sympathetic nervous system, reduces the activity of the sympathetic system. Drugs used in oral form, tablets, capsules, or injections. In oral form, most digoxin is absorbed in the small intestine and then distributed further. Some tissues, concentrations are usually concentrated in the kidneys, heart, liver, adrenal glands, gastrointestinal tract, and are mainly metabolized by the liver. Urine excretion. Only one part, about 25%, is excreted through the bowel pathway. In adults with liver function, kidney, normal, the mean half digoxin, oral, 36 hours. Distance between treatment concentration and concentration of poisoning is very narrow, so it is easy to occur drug poisoning. Previously, people started to use the dose attack, then switched to the dose maintain, but nowadays people often no longer use doses of attack with a large amount of drugs in a short time as above, because this way is very dangerous for patients. In most cases, physicians usually start with maintenance doses to reach the therapeutic dose. Care should be taken not to combine digoxin with calcium because of this combination. Severe cardiac arrhythmias can even be fatal. Digoxin poisoning. Some statistics have shown that patients taking digoxin are poisoned, about 5 to 15% of the total number of patients taking the drug. The clinical manifestations of digoxin poisoning are, when the patient is on medication, see some of the following symptoms: gastrointestinal disorders, anorexia, nausea, vomiting, diarrhea, nervousness, headache, dizziness, hallucinations, disorientation, delirium, cardiovascular disorders, increased stimulation, increased automation and reduced conduction, myocardial infarction, arrhythmia, atrial fibrillation, ventricular tachycardia, sinus blockage, atrial ventricular block, top ventricle, ventricular fibrillation. At the time of diagnosis, electrolyte disturbances, acid reflux, baldness, or baldness should be immediately discontinued. Kali plus blood condition. If lowering potassium plus by giving the patient a 10% potassium chloride solution. In case of need, potassium chloride may be infused into a vein after dosing into an isotonic solution. But under potentiometric conditions, intravenous infusion should not exceed 13 to 15 millimole per hour. Intravenous atropine may be used with slow rhythm due to atrioventricular blockade. For ventricular arrhythmias, especially peripheral ventricular arrhythmias, treatment may be given by lidocaine. We also use a relatively new method to treat digoxin poisoning, which is the specific antibody of digoxin. When this antibody is combined with digoxin to form a complex, it is eliminated by the kidney. Take effect of digoxin. According to the doctor. Source: Life Health. Thank you for listening, and remember to sign up to support this channel of ours. Sincerely thank. Here's a list of plants that are used as raw materials for the preparation of medicinal products and are digoxin. Digitalis purpurea, Western European origin, is a species of bubbling. Small, tall, about 50 centimeters, single stem, straight stem. 3 tops can be up to 3 times longer than stem. Broadleaf tongue, bellflower, violet, white flower blossom. Or the flower vibes that are most often grown in the country, in the West, at the venues, doors. Digoxin, digitoxin and lanthanosides, anthraquinones, flavonoids, VA saponins. Digoxin strengthens the heartbeat but excretes very slowly. Digoxin is often used as a long-term treatment in the history of medicine. The famous landmark of William Withering, a British physician, 18th century. Because of curious recipes from local herbalists, his discovery of medicinal uses of plants. His work has led to the production, distribution of the drug digoxin for humans. Drug use in the use of capillaries. Capsaicin has a very beneficial effect on heart disease. Heart disease worsens as the ability to maintain normal circulation decreases. Cardiac glycosides make the heart beat harder, slower and more even without much oxygen. At the same time, the plant stimulates the production of urine, which lowers blood volume and reduces transport to the heart. Note: if overdose can be fatal, use only when directed by a doctor. This plant is banned in some countries. Technique of planting geraniums. Planting soil. Before planting, select the soil to be porous, full of nutrients. You can use fertilizer to mix well with soil, then water to create moisture and sow seeds. Sowing. When seed is ready for planting, sow the seeds directly onto the soil and cover with a thin layer of soil, maintaining the water until the flowers germinate. Mao Tai Hoang, purple bellflower, Digitalis purpurea, Geotangi, Maoguan. Maoguan, hard earthenware, purple bellflower, technique of gouache. Once the seed has sprouted, you can move to a smaller pot for convenient care. In the mature plant, cultivate 1 to 2 times, because the roots of the tree to the ground at 400, so when weeding, you should scrape soil about 3 centimeters deep to not hurt the roots. When the tree is 10 to 13 centimeters high, prune and cut flowers. Trimming small plants, leaving healthy plants. But one thing you should pay attention when pulling the seedlings. Use scissors to cut the trunk on the ground. Do not use the hand to spit because it will make the tree next to the root and die. Thus, the plant will grow better and flowers will grow bigger because of nutrition. Focus on supplying plants and root crops. The mature trees need a lot of water, but not too much water, 3 to 4 times a day. From the homepage of the National Institute of Medicine and Pharmacy, please click here to subscribe to our channel. Thank you.